disability, and then also thinking about different responses to sexual violence outside of criminal law. We do,
Sorry, silly. Sorry, Kat.
yeah, go ahead.
Is it okay if we record?
Yeah, that's
We should have
fine
asked
with
you
me, no
before doing
problem.
that. Okay, thank you so much. Sorry
No.
about that.
Oh no, that's okay. Um, we also use a lot of digital advocacy. So, advocacy through social media, through newsletters. And that's some of the work that we're hoping to do in relation to this issue. Will be promoting our advocacy brief that we worked on with Cynthia and pushing for change through online advocacy. And that's something where folks can help as well in terms of sharing and promoting that kind of information. And then lastly, we participate in coalitions and movements. So this is a great example of coalition work, working with the Waterloo Region Community Legal Services to push for this type of advocacy. And then the last thing I'll talk about quickly is just it was mentioned, both Celia and I work on LEAF's reproductive justice project. And this is advocacy that we are doing that is focused on pushing for law reform in the different provinces and territories that advances reproductive justice. And when we say reproductive justice, we're really talking quite holistically. So a lot of people hear reproductive justice, reproductive rights. They think about things like access to abortion, access to contraception, and those are really important things. But reproductive justice is also about making sure people have access to the resources and supports they need to raise the families that they want to. So in this case, when we're talking about international students who are pregnant, it's making sure that they have access to the prenatal care that they need, the birthing supports that they need, and the care that they require after giving birth without having to pay for it out of pocket, because that can be a huge barrier for a lot of people. I think that I got excited and I skipped ahead to this slide already, and I suspect potentially the next one. So there you go. I'm ahead of the game. But that's just a little bit about LEAF and our reproductive justice work. And I think, Celia, I will turn it over to you now to talk more about this issue.
Thanks, Kat. So yeah, I think we all know how this issue came about. Cynthia had brought it to the attention of a community legal clinic in Toronto, who then looped LEAF in. And yeah, both Kat and I we heard about this issue, we're also like, why is this happening? This should not be happening. And we're really excited to partner with Cynthia on doing advocacy. I know Cynthia's already done amazing work supporting students on a one-to-one level, but we really want to see change on the systems level so that students aren't having to struggle with this. One second, I just lost my mouse here. How am I able? Okay, there we go. So we did some research on this issue, and so I just want to go over some quick facts I think that are relevant and important. So in Ontario, before 1994, international students actually got access to OHIP coverage, which is the health insurance that Ontario residents receive. It was not until 1994 that international students were removed from OHIP coverage. And once they were removed from OHIP coverage, the province mandated that every college and university in Ontario, in order to enroll international students, they had to have a mechanism for international students to enroll in health insurance. And as you all might know, international students are required to pay for this health insurance as part of their enrollment. When we did some research into kind of universities and colleges, we actually found that international students attending universities in Ontario will receive coverage for pregnancy-related costs regardless of their date of conception. So this is an issue that unfortunately is unique to college students. So when looking at college insurance plans, we actually looked at every single college insurance plan that was publicly available. I think it was the majority of them, 90 to 95% of them we were able to have a look at. And the majority of them will only cover pregnancy-related healthcare costs if your date of conception is either on the policy start date or up to 30 days before. There's one college that will cover you if your date of conception is up to 60 days before, but that's only one college, and none of them will cover any more than 60 days. We also found that college student associations negotiate some of these healthcare plans, which is really interesting. Something else that's important here is that midwives provide services to people regardless of their status in Ontario. So you don't need a health card, you don't need to be a resident. Anyone can find a midwife and get services for free. The province will cover that. However, availability can be an issue, and that's something that Cynthia brought to our attention. There's just not enough midwives and not enough services for everyone to be able to access a midwife. And in any case, people should be able to access all the care they need, not just through a midwife. That's just one way. We really want to expand it so that, you can get coverage, period. Also important to note that healthcare is more expensive for people who don't have OHIP coverage. So if you go to a hospital, you will be charged more, or like the hospital bills are more for people without insurance, which is not great. Next we'll talk about the changes that we want to see. Obviously, we would love for OHIP coverage to be extended to international students again. We also want a healthcare program that the Ontario government implemented during the pandemic that ensured some healthcare coverage for people in Ontario without insurance. However, we're working with the provincial government that isn't really cooperative when it comes to healthcare, and that has made a lot of healthcare cuts. So this really is a stretch goal. For the Ministry of Colleges and Universities, so this is a branch of government that kind of not takes care of, but is in charge of the colleges and universities in Ontario. We would love them to update the requirements they have for post-secondary institutions in order to enroll international students, to include a requirement that says that health insurance that you provide to your students, they have to be the same as OHIP. So that includes covering pregnancies, no matter what your date of conception is. Two other changes that we're pushing for were because the administrators of individual college insurance plans have control over negotiating those plans. We want each administrator, so that's the student associations at some colleges, to negotiate with the insurance policies, or the insurance providers rather, to ensure that the insurance plans that they're offering international students includes all OHIP covered services, and that includes coverage for pregnancy-related care, no matter what your date of conception is. And finally, for the federal government, we want them to pass and implement a comprehensive and inclusive regularization program that includes healthcare coverage for everyone. So this is actually something that the federal government promised, I think almost 2 years ago, to ensure better pathways for people to become permanent residents of Canada, but we haven't seen this happen just yet. So now we'll talk a little bit about our plan. So as mentioned, we've created an advocacy brief, which I include a link to in the next slide if you'd like to look at it. It essentially just covers everything we've chatted about, but more briefly. We also want to spread the word. We've heard that this is an issue that not many people know about. We actually met with the College Student Alliance, which is a group that kind of represents different college student associations across Ontario. We met with them last week, and they told us that they have a feeling this isn't an issue that many colleges know about. So spreading the word is a really important piece of our advocacy. We are also planning and have already reached out to and requested meetings with key stakeholders and decision makers. We're also creating a one-page resource with information for pregnant international students. And once that's ready, we're really happy to share it out or share it with everybody. And we also want to print out the advocacy brief and the one-page resource and send it to the different stakeholders. So, if they don't respond to our email, they will get the paper advocacy brief at their door. And so I'll just leave this up for a quick second if anyone is interested in scanning the QR code and having a look at the advocacy brief. It essentially just covers kind of what I've chatted about, the context, the history, so yeah, background, and the changes that we want to see. And our progress so far. So our advocacy brief is published. We've started outreach to college student groups, politicians, grassroots migrant rights and healthcare organizations, and we've gotten really good feedback so far. So far, the advocacy brief has been shared by some national, provincial, and local organizations to their networks, which is really awesome. We've got meetings planned with the College Student Alliance. Like I mentioned, actually, that meeting happened last week. Migrant Workers Alliance for Change, we're still nailing down a date for that meeting. And lastly, the Conestoga Colleges Student Association. Kat, Cynthia, and I will be meeting with them next week to talk about this issue. I also, I think want to end just with some resources that are available for international students. And don't worry about, writing everything down. The PowerPoint I've sent to Ivy, and Ivy, please feel free to share with everyone after the presentation. So Migrant Students United Hotline, they have supported pregnant students before, and in our communications with them, they said that they supported a student with a bill of $30,000 from the hospital, and were able to, successfully advocate for that student and get that bill reduced, which is really great. One Voice Canada is also an organization that is comprised of and supports international students, and that's their email address if anyone wants to reach out to them. I've also listed here, I won't go over them one by one, but just some pregnancy options counseling. These are all free options. If you find yourself in a situation where you're pregnant and you want to talk about your options and what's available, these are all free, non-judgmental, fact-based organizations that you can call or email or request appointments with. And I think lastly, just some healthcare resources. Like I mentioned, midwifery care is free for everyone in Ontario, regardless of your status or whether you have insurance coverage through the province. So you can find a midwife through that website there. And the Uninsured Health Network, which I know Cynthia has worked with. This is a group comprised of healthcare professionals, healthcare workers who support people without health insurance in Ontario. And to wrap up, I just want to reiterate that international students are welcome here. The Government of Canada, this is actually from their website, they recognize that international students provide tremendous social, cultural, and economic benefits to campuses and communities across Canada. So, international students really are an asset to this country and to Ontario. Recently, don't know if anyone else has been keeping up with the news around housing. We've seen a lot of news stories that's kind of blaming international students, blaming immigrants for the housing crisis. I just want to say that is not true. International students are not raising rents. They're not raising housing prices. That's landlords and that's homeowners and that's realtors. So you're not responsible for, the economic state of this country, for this housing crisis. In fact, the government itself recognizes all the benefits that international students bring to this country. So just want to say that you're really welcome here, at least from me. And I believe that brings us to the end of our presentation. And Kat and I and Cynthia and Ivy, I'm sure too, are very welcome to take any questions you might have. And I will stop sharing.
Okay, that was amazing. Thank you so much, Celia. I don't have any presentation anymore, so we'll just take questions. I don't know if anybody has any questions. You can put it in the chat or you could raise your hand and ask. This is a safe space, so ask any question you have. Okay, I see Bright's hands are up. Bright, you can unmute and ask your question, please. Thank you.
Thanks everyone for that presentation. I do have a curious question to the last presenter. You did say in your presentation that there is a discrepancy between the coverages for university students and coverage for college students. And you also say that the Students Association, I believe, negotiates these coverages. Do you have any sense of understanding if, in this particular case, this pregnancy coverage was intentionally left out in the negotiations between the colleges, or was it an oversight that they didn't realize to include it? Or was there some other reasons why, maybe cost reasons or leverage reasons why that coverage wasn't included in the negotiations for the colleges, for the coverage that the colleges negotiated?
I can jump in and answer that question. So it might be helpful to provide some background about the coverage for universities versus for colleges. So all the universities, except for one in Ontario, they have the same health insurance plan. It's called UHIP. So it's all the universities pretty much got together and kind of collaborated on this one healthcare plan for international students. And so, you know, by pooling resources, I'm sure one that they were able to, you know, get more money, perhaps, that's my guess, to create like a more robust like system or policy, whereas colleges, they don't have this kind of system where a bunch of them came together and have like one single insurance policy. Each college kind of has their own, right? And so it's hard to tell what kind of what the reasoning is for each college's decisions around the pregnancy coverage. I will say that there are just a few insurance companies that provide all of these different coverages, and none of them have the option to, at least that I could find, to have that insurance coverage be available regardless of your date of conception. And so we'll be talking with at least one student association next week, and we plan on talking to at least one more. And so hopefully we'll be able to get more answers then. I have a feeling that it probably is a mix of oversight. You know, I don't think it's good enough for them to use like, oh, it's too expensive as an excuse, because students are paying for their own insurance coverage, right? It's not like the colleges are paying for these policies. Students are paying for this coverage as part of their insurance. And so the colleges can't really be like, oh, we can't afford it. Well, it's like the colleges, you're not paying for it. It's the students who are paying for it. So yeah, I hope that answers your question.
Thank you so much, Celia, for answering that question. I have two questions on the chat, but I'm going to take Peace Iduko first before I read the questions in the chat. Peace, you can unmute yourself, please, and answer, and ask rather.
Okay, hi. Good afternoon, or yeah, good evening from here. So I want to ask a question regarding for Fanshawe College.
Please, you're muted. If you can hear us, you're muted. We can't hear you again.
Hello, can you hear me? Oh, I was talking. I didn't know I didn't unmute myself. Good afternoon. Okay, so for Fanshawe College, we have I'm schooling in Fanshawe College, so we have something that actually covers for students who are pregnant. But unfortunately, the policy does not cover for students who get pregnant before the school start dates. So now, students who get pregnant after the before the school start dates are having challenges of getting health insurance, getting to find a doctor and all of that. So in this case, I don't know, how do you come in to assist international students?
I can answer that question.
Ask for more care. Yes, please.
So there are a couple of things you do. From Celia's presentation too, she mentioned getting a midwife. So midwives are free for whether you're visitor, immigrant, wherever you are, it's free for everyone. But the problem again is getting a midwife. We have limited
Yes.
available. So my advice is always, as soon as you conceive and you know you're coming to Canada or you're already here, register, call the midwives, call and be on the wait list if they have no opening at that time for you. And then keep looking. I had some students who had to register with 3-4 different midwives. And luckily for the 2 of them, they were called, right? After waiting for like 3-4 months. But before the baby came, they were called. And I've also had students who, up till now, they don't have midwives because there are no midwives. There are not enough midwives, right? So there are a lot of things that a student can do. There are a few things, sorry, that a student can do. While you're waiting for midwives, you could register to have a baby with an OB. But there's a new thing they do now, which was on their towards the ending of last year. They now demand $5,000 as deposits. So it's like you have to do it, right? That's where I get stuck anyway. But for the hospital bills, you could do a payment plan with the hospital. One drastic thing we did for one student was to request that policy. We knew what the policy was, but we asked the school to send. In fact, the email went like this: my lawyer wants you to send me the policy that says I can't get pregnancy benefits even though I pay the insurance premium. In that case, we advise the student to make sure she gives the hospital the details of her insurance. So the hospital tried to build insurance. I think they said they're going to try 3 times. I don't know how many times, we don't know how many times they tried. But after about 4 months, the insurance wrote to the student and said they've paid all her hospital bills. But she was lucky she got a midwife. So again, it involves you standing up for yourself, writing to the school and saying, I'm paying premiums. How come I'm not being covered, right? And what I've asked in our NIROW group is, if you have a situation like this, you can send me a message. I can guide you on what to do. I know a lot of students don't like bringing themselves out. I've had those situations. I can understand that. Even when you stand up for yourself, you won't get in trouble, but some people think they will. But you won't. You're standing up for yourself. You're paying these premiums, so they need to cover you. So that's why I felt this advocacy brief with Leave will be more beneficial. Instead of individual students fighting for themselves, if there is a policy change that will benefit everybody, then that will be helpful. Because we've had some successes of advocating for individual students, and some other cases we haven't been successful. So it depends. I don't know what it depends on, but this has been my reality so far since last year. So for I don't know what stage this pregnant student is, but try as much as possible to get a midwife. If you can't get a midwife, in the meantime, get an OB, because it's very important. We've had 3 mothers, 1 last year and I think 2 this year, who had complications. My own sister had complications. We had to rush her to the hospital. So whether you have a midwife or not, there is still that possibility that you can have your baby in the hospital. And what are those plans? You can do a payment plan. In fact, you can do a payment plan with the hospital as little as $100 a month. or even $50 a month. Because if you want to buy a house or rent a house, or you want to have some form of good credits in Canada, you need good credits. And if you are owing any debts and your name is taken to collections, you won't be able to get a lot of things. You won't be able to rent a house. You won't be able to buy a house. And when your credit is ruined, it's very hard to get it back. So it's planning, advocating for yourself, talking to people that can help you, and making plans so that we don't have complications with pregnancy. I think I've spoken to, sorry. Okay. I don't know if that answered your question, Peace. Peace.
Yes.
Okay.
Thank you so much.
You're
Thank
welcome.
you.
I have another question here. It says, for an international student who has deferred her program as leave for her childbearing, can the student still get the free treatment before and after birth? Sophia. I don't know if anybody else wants to answer the question. I tend to talk too much. Celia, Kate?
The question is not very clear. Do you understand? Maybe you can rephrase so that maybe Celia and
So this question is, if a student defers their program, so they are supposed to start school and they decide to defer the program to take a leave to have their baby. The question is, will they get free treatment before and after having their baby? I'm trying to understand the question myself.
So I'm thinking maybe the student is in Canada and this takes a leave of absence from school to have her baby. And she's wondering if the insurance will still cover her since she's not enrolled in school.
Oh, the insurance itself, right?
Yeah, I guess so.
I think you're right.
The insurance will cover her post and prenatal. Before and after birth. That's what she's saying.
Right.
Sophia, if you can maybe elaborate so that we are not we
guessing.
Yeah, we're not guessing. Or you maybe type the question.
Yeah,
so that...
hello. I don't know if it's what I heard that there are midwives that give free treatment. So I was saying that was what I was asking. For international students who have already defined, can that student still get that free treatment from midwives?
Yes.
Anybody in Canada.
Anybody in Canada gets the free treatment so long as you're able to secure a midwife. Did that help? Did we answer your question? All right.
Adebola has her hand raised.
Okay, I was going to read her question next, but yes, Adebola, please unmute
Yes,
yourself.
sorry. Good evening. Sorry, I was in the bus, so I was trying to rush home so that I could speak up myself. So before I left the bus, I had to type so that just in case I missed the meeting and all. Yeah. So, okay, I think I need to just open up. I conceived before I came into Canada. I came in this January, so I conceived before, just like a month before. So when I got in here, I heard that colleges don't accommodate pregnancy and delivery in their insurance plan, except you conceive here. So I've been asking some people. Some said I should look for a midwife, and like the moderator said, that it might be quite it's not so easy to get a midwife, but I could still try. So some people say that at the end of the day, that sometimes, God forbid, I don't pray to have complications. At the end of the day, they might still refer you to a hospital, and then you might need to pay more something. So my question is, okay, if I'm able to get a midwife, is it possible for me to use the services for antenatal and then deliver in a hospital? I don't know. Can it work that way? Can they refer me to hospital? I don't know if I'm being considered at the end of the day. So basically, that's my question.
So first, you need to go to your school clinic to register that you're pregnant, and I think they usually do a pregnancy dating test, and at that point they will tell you if they will cover you or not. But while any student is doing that, It's
Okay.
also very important to apply online for midwife, different midwives. In fact, my sister
Okay.
applied in Cambridge, in Toronto, in Kitchener, Waterloo. She applied everywhere, right?
Okay.
And she didn't just apply online. She applied and she was calling them.
Okay.
So like we said, it's a planning. You're bringing a life to the world, right? It's a planning thing. You need to try everything you can to get a midwife. The other
Okay.
part of your question is if you need to go to the hospital, even though you have midwives.
Like, can they refer me to a hospital to give birth? Because God forbid, like the lady I spoke with, she said she had complications and then they had to refer her to the hospital at the
Right.
end of the day. So she was advising that if I can speak with them, if they can refer me to the hospital, that if I can just use their services for antenatal. So I don't know, is it possible?
So it's possible.
Okay.
In this place, in this region, some of the midwives will tell you can have your baby. They will deliver your baby, the midwives, but you can do
Okay.
it at the hospital. Some people choose to do home births. Personally, I don't
Okay.
like home births.
Okay.
My sister was going to do that, but she had complications, so we had to rush her to the
Oh,
hospital. So, but finally, the school insurance paid the hospital bills,
oh, okay.
so she didn't have to pay anything,
Oh, okay.
right? But it involved that advocacy, right? Not just taking no for an answer. I've had
Okay.
another client who the hospital canceled her bill, about $10,000. She's in NIROW too.
Oh,
So it's still that advocacy. So she started with asking the accountant, the hospital accountant, can you cancel this? I'm a student, I don't have any money. They said no.
okay.
So I told her you need to go someone above those accountants. So she finally got to I think she got to I can't remember, but I think she got to the medical director and they canceled her debts.
Oh,
So it involves a lot of advocacy. And like
okay.
something I've been telling myself, I'm getting old. I'm not scared of rejection. If I ask something and you say no, no problem, but at least I've asked, right?
Yeah. Okay. Okay. Thank
Did that answer
you.
your question?
Yes, you did. Thank you.
I don't know if Kat or Celia have anything to add, or even Ivy.
No, basically, you said everything. It's important that people learn to advocate for themselves.
Right. And if you need some help advocating for yourself, you can call me. I don't know how Ivy is comfortable with people calling her, but I'm speaking for myself.
Oh, no, they can call me. They can call me.
Okay,
Yeah,
so
sure.
right, so but at least when you apply online for midwives, call them.
Yeah.
Call midwives, yes, call each of
Okay.
them.
Okay.
You'll be lucky you'll get someone. Even if you
Okay.
don't, the hospitals are still there, the OBs are still there. Asking for a payment plan will be helpful.
Okay.
But in the
Okay.
grand scheme of things, this advocacy with leave, I'm praying and hoping it will change things for pregnant international students. It's very exhausting fighting for one person and then the next day you have to fight for another person.
Another person, yeah.
It's quite exhausting. Because I've seen cases where they say yes to one student, the same insurance company, and then they say no to the next person. You're wondering, why are they treating people so unfairly, right? But if there is a policy that says you must cover everybody, then there won't be that unfair disparity for different people.
Okay.
The slides that Kat and Celia use has a lot of resources.
Information and resources, yes. And I'm going to send them out to everyone who registered for the workshop. I'll send them to their emails. You can find numbers, you can find emails of resources that can be helpful to you there. So after the workshop, I'll send them out via the registered emails.
Okay, thank you so much, Ivy. I have a few more questions. I'm checking the time too. So there's one question here. It says,
Anastasia.
Oh, there's Anastasia. Okay, can you read that one, please? I can't see
For
that
an,
one.
for an international student who's already in Waterloo, who couldn't secure the services of a midwife since September before coming to Canada, and is already over 30 weeks pregnant, what's your advice and recommendation?
I'm gonna allow Celia or Kat answer that question. I tend to talk a lot.
Yeah, no, that's okay. It's helpful, Cynthia, because with the work that you do working directly with individual students, I actually think you're much better placed to answer this question than Celia and I are, because we don't work directly with people. We do that higher level advocacy work.
Right.
So I don't want to put the burden on you, but if you're comfortable answering, I think that would be better.
Okay, thank you. I'll leave the higher level questions for you. Okay, so yeah, I had this situation recently and I didn't know what to do, sincerely. We couldn't get a midwife. So we asked, I recommended that the student ask the OB, accept the OB, right? Because you need someone, accept the OB and negotiate a payment plan. I think some of the OBs are pushing back on that, but I didn't hear back from that student. So I'm not sure what happened. But I also advised her to register with the hospital, register that she wants to have her baby in the hospital. And I think if you do that, then the hospital, probably an emergency OB may have to deliver your baby. I'm not sure how they get billed, how they get paid if it's the hospital, if it's done through the hospital. I haven't heard from that student, so I'm not really sure, but the advice is go to the hospital, register that you don't have an OB and you don't have a midwife and you need to have your baby. I don't think they will turn you away.
And then, Cynthia, some people here have spouses who work full-time and are eligible for OHIP, and they don't know that they are eligible for OHIP.
Thank you.
Also covers their spouse, so you can elaborate on that.
Right, thank you so much. I think I posted that on NIROW Telegram because I realized some people are not aware that when you have a full-time job, a full-time permanent job, and full-time, it's 30 hours a week. It doesn't have to be 40 hours. Full-time permanent job, you can get a letter from your employer and go to any of Service Ontario office and apply for OHIP. So you apply for your whole family, including your pregnant wife. Or if the woman herself, if the student has a full-time permanent job, she can do the same. And from my practical experience, some of the Ontario Works offices will say, oh, no, you don't qualify. Just say, okay, thank you. Go to another office. It personally happens to me. And it has happened to a few people I sent to Service Ontario. I'm not sure where the disparity comes from or why they have it. I don't know. But if you try one and they say no, go to another one.
Yeah, but that's a resource that many people don't, take advantage of. So
Right.
if you have a spouse who is working full-time, you're eligible to be covered under OHIP.
Under
So
OHIP,
please
yes.
access it. I'll put the details in the group, in the NIROW group later after this.
Okay, thank you so much, Ivy.
Yeah, and then I'm noticing that Kath and Celia are putting down some other resources about pregnancy in the chat. So please try and access them. You can click on the link so that after this, you can also access them and see how they can be helpful to you. Someone is asking, is hospital different from an OBY?
Yes. But OBY is just the specialist, right, that delivers the baby.
So where do they do the deliveries?
They don't have, sorry?
Where do they do the deliveries?
In the hospital.
Okay.
So midwives can do delivery at your home or at the hospital, midwives, okay?
Okay.
That was what happened in my sister's case. OBs deliver babies at the hospital. So there are two fees. There'll be the OB's fee. There'll be, if you take epidural, so Ivy, please help me. What do they give again?
Epidural.
Yeah, what's the I can't
Yes,
even
yes. We know.
anesthesiologists. So those people have to be paid separately and they take their money cash.
Oh,
If you don't
okay.
give them their money, they won't give you epidural for pain.
Okay.
Right. So, but when you're charged for that epidural, you could submit a claim to the school insurance and see if they will pay for it. They should, right? So there are 3 charges. If you take epidural, you have to pay the specialist before they give it to you. And then if you use an OB, you have to pay the OB separately. And then you have to pay for using the hospital resources separately.
Oh, okay.
Yes, but if you go to the hospital and an OB who is already at the hospital delivers your baby, I think, I'm not very sure, but I think the charges will be together because the hospital has to pay that OB. It's yeah, but the epidural specialists, you have to pay them from your pockets. So when you're going to the hospital and you want epidural, make sure you have a credit card or at least cash or a debit card.
Okay. Someone else is asking, do you know if a student can access care for fertility, international student?
I'm not sure. You will have to ask a doctor to refer you to a fertility specialist. I know some aspect of fertility is covered by OHIP. I'm not sure how far it's covered, but you need to get a referral from a medical doctor to a fertility specialist. I think you just need to try it. So I think some of the anyway, let me not say what I'm not sure of, but yeah, get a referral and go. They would figure that out for you. Somebody also asked if the person requires surgery. So surgery is done so for a C-section, right? I guess that's what the person is saying. C-section is done at the hospitals. You have to still pay for the surgery and pay for using the hospital facilities. So it could be planned C-section or an emergency C-section. So it's still the same fee pattern. You need to pay for the epidural, you need to pay the OB, and then you need to pay for hospital facilities. The good thing is when you have your baby can get OHIP, so you don't have to pay for the baby's delivery. No, not the delivery. You don't have to pay for the baby's health care from as soon as the baby is born, right? The baby will be covered. I was told some hospitals in Toronto were not allowing moms and mothers apply for OHIP. I don't know how or why. But in Kitchener, Waterloo region, they tell you this, you need to do this. In fact, sometimes they apply for you immediately. So they apply for the birth certificate, OHIP, and I think there are 4 things they apply for at the same time. Can't remember them. But yeah, you don't have to pay for your baby.
Okay, I see that it's 5 p.m. and Celia and Kat said they'll be here for just an hour. I don't want you to feel like you're obligated to stay longer than 1 hour, except you're enjoying our discussions. You are welcome to leave anytime you want to. We just want to say that we're grateful that you were able to join us for this. Thank you for the resources you provided, the insights on the advocacy that LEAF is doing for reproductive justice. And we hope that something comes out of it so that, we won't have this back and forth any longer. Yeah.
Thank you very much for having us. Thank you for all of the work that you're doing on this issue. And thank you to everyone who attended as well. And best of luck to everyone who is pregnant. I hope that you have healthy, happy babies. And we really appreciate the opportunity to be here. I do have to sign off, so I'll do that now, but thank you so much.
Thank you.
Oh, yeah, thank you so much, Kat and Celia. We really, really appreciate you. You have no idea. Thank you so much.
Thank you.
Okay, I have a few more questions. I don't want anybody to feel like we neglected their question.
My spouse is an international student and I'm pregnant. Please, can you have coverage for me?
My spouse is an international. Who is this? Okay, the lady is pregnant.
The lady, but her husband is a student,
Right.
like the dependent.
Like we said before, you can try getting a job. So long as it's full-time, 30 hours a week, and it's permanent, it's not contract, you can apply for OHIP. They say usually after 3 months, but what I say is try. So long as you have that job and your employer is willing to give you a letter, just go to Service Ontario and apply. If they say no, come back in 2 months, then you go back in 2 months. Actually, no. If they say, let me put it in the right order. If one office says no, I think we have 3 offices in this region. I'm not sure. There's one in Cambridge. There are 2 in Kitchener, one on Duke Street, one on Manitou Drive. Go to all of them.
They only do OHIP at Duke Street. The one in Hespela and the
one in Manitou doesn't do it right.
Yes, and Hespela they do not. Everything has to be done at Duke.
There is one on Weber. Have they closed?
That's Duke Street off Weber.
No. So when I came in 2012, was it 2012 I did that? We went to one of the offices in Kitchener, they said no. And we went to a different one and they said yes. Except if they've changed everything. That was a long time ago.
As of today, it's centralized. Everything is done.
Oh my goodness. That's not
And
good.
you don't need to have worked for 3 months. You can get the job offer today. All your employer needs to do is to just write a letter stating that you're a full-time employee, your job is permanent, and you'll be there for at least 6 months.
Okay.
Yes, I have the requirements here. The letter or contract must state that the employee is working full-time. It must state the title or occupation of the position, and that the employee will be working for the employer in Ontario.
Right.
It must state the start date of full-time employment, and that the employer intends to employ the employee for a minimum of 6 months.
Okay.
On the company's letterhead. I'll put all of that details on the group.
Perfect. I was going to ask. Thank you so much, Ivy. Things are changing so fast. Okay, yeah. Somebody asked again, can I apply for a midwife while still in Nigeria? Yes, please do it. You don't have to call them, apply online.
Mm-hmm. But when you come into Canada, please call.
Yes,
anything,
as soon as you enter Canada, call. Yes.
Follow up on your application. Yeah, so they don't let you. Somebody saying, my question is a little bit more personal. What over-the-counter medication? What over-the-counter meds without prescription can one use for nausea? Are not medical people here.
Yeah, this one is for doctor or nurse practitioner.
Yes, so we can
provide. We're not allowed to give you that information. That would be, yeah, we're sorry. But you could go to a walk-in clinic.
Yeah, there is also a hotline that you can call in Ontario that's run by nurses. So I'll put the number on the website there. You can call them and they would be able to give you medical advice.
Thank you so much, Celia. I didn't know that. I'm going to save that number.
So basically, what this whole our whole workshop boils down to is we must learn to advocate for ourselves, whether you're registered. So the student medical insurance does not cover pre-existing conditions, but we have heard from Cynthia that some people have, as it were, twisted the arm of the student insurance and they've had to let some of their bills go, right? So, and why? Because they advocated for themselves. They said, I don't have money. I can't, like, if you turn me upside down, remove all my pockets and shake me, you won't see anything inside. And so they had to, let them go. So if you are in that situation where things are really, it's not easy for you, our advice to you is you need to stand up and say, this thing, I don't have it. Like, I don't have it. What can you do for me? How can we go around this matter? What are you willing to try and see how you can negotiate the costs? These things, there's no one size fits all. It all depends on how aggressive is not the word. How persistent you are, yes. When they see that this one is not going to budge, they'll say, okay, you can go with it. Oh, let's see how we can take it out for you, you know, and all of that. While Leaf is working on trying to, you know, get students covered under OHIP. In the meantime, this is what we can do. We can advocate for ourselves. We can say we don't have money. You know, what can you do for me? Try and get into reach a payment plan where you can be paying it at a level where, you know, it's something you can maintain, $100 every month, you know. And then if that is for people who are very close to, you know, delivering. If you're just finding out you're a month gone, you can start looking for a midwife now, right? And start planning for the baby too, just in case anything else happens. Hopefully before you are due, maybe the advocacy would have, you know, would have been successful, and they'll be changing the policy. Who knows?
I will also add, if you get a bill and you're negotiating a payment plan, ask them if you can pay the OHIP rate, because the OHIP rate is going to be lower than the rate for non-OHIP. So if you say, can I pay the OHIP rate and can we negotiate a monthly plan? Hopefully that will result in a bill that is lower and with lower monthly payments.
Thank you
Yeah,
so
that-
much. Yeah.
Yeah, thanks, Celia. That's very true. I didn't even know I'm learning a lot today. I didn't know there were different bills for OHIP and non-OHIP.
Yeah, it's unfortunately much more expensive for people who don't have OHIP, and we will be including all the links that we shared in the chat, as well as you know, what I just said about OHIP. We'll be including it, like we're creating the one-page resource. So once that's finished, and we'll be getting it translated in different languages as well, we can send it over to you, Cynthia and Ivy, so that you can share it with everybody.
Okay, thank you so much. That'll be very helpful.
Yeah, and I also have to hop off now as well, but if anyone has any questions about the advocacy, you know, yeah, I think Cynthia has my email, and yeah, feel free to connect. So yeah, thank you again for inviting us, and best of luck, everyone. Bye.
Bye.
Thank you so much, Celia.
Yeah, thank you so much. We really appreciate you. All right, take care. Ivy, I will let you wrap up. I think I have another meeting I need to leave. And I think we've pretty much done what we wanted to do.
Or try to manipulate God into giving us what we want.
Thank you so much, Cynthia. I hope we've been able to answer questions that have been on people's minds. So basically, all we are saying is advocate for yourself. Cynthia talked about someone who went through this process, and because she advocated for herself, she didn't have to pay a dime. Some other person went through the process and was able to get a payment plan structure, so she didn't have to pay out of pocket, like pay through her nose, you know, to deliver her child. So as you can see, there are no straight processes. It's how you open eye. Let's talk like how Nigerians now. If you open your eye if you do like, say, you know waiting day, they go say, oh, this person know waiting day, they will calm down for you. But if you are just doing gentle, I don't want trouble, and how do you do it? They will give you how they do it. This thing is tested and it's proven. So if you go tell them, see, oh, I don't get money, what I go do for me? How you want to do it? Or like Cynthia said, my lawyer said you can always reach Cynthia. If you want to be able to reach Cynthia, you can contact me on the NIROW Telegram, and then I can give you her contact. You can always reach Cynthia. She said her sister wrote, or somebody she worked with wrote, my lawyer said, tell me where you cannot cover this thing in this brief. I want to see where it is. When they see that litigation is involved, everybody will sit up. They say, we don't want trouble. Let this person go, you know, and all of that. So it boils down to you being able to advocate for yourself. Don't just accept the status quo. If you don't have money, you are seeing the big money they are calling for you. Go and tell them, no, I can't do this thing. I know of somebody else who even waited till, you know, when she was about to deliver, they had to rush her to the emergency the emergency room in the hospital, and then after the delivery and all of that, because it was an emergency, they had to deliver her. When she finished, she said, "Ah, that is it. Oh, I was in the house. I wanted to give birth in that because I don't have money to come here. It's condition that brought me here. So what are you going to do for me?" She ended up leaving the hospital with a very, I think she had to pay everything like 2K or so. And it was also structured. She didn't pay it at once. So it's tough. It's not easy. It's not straightforward because of where we are and the policy in place. But you need to open your eye and to advocate for yourself if you want to get it cheaper than what they are telling you now. And then if you are already pregnant and you still have some time, please try and see how you can connect with a midwife. Now, while we hope that the advocacy that LEAF is doing comes true. I hope we've been able to help some people this evening. If there's anybody else who still wants to ask any question, we're open for questions. If you still need some clarity or clarification, please go ahead and ask. You can unmute yourself and ask, or you send the message in the chat. Please, let's these resources that have been posted in the chat box, please let's take them seriously. And like I said, I noticed that there were some resources that Celia included in her online presentation. You can call those people to ask them how they can assist or help you. In Canada, these things they're everywhere, right? So when I send out the PowerPoint, please do well to look into them. You'll find help there. So if there's any question, please.
Sorry, Ivy, I just remembered something about the over-the-counter medication thing. So pharmacists can prescribe, they can give you medication for little ailments. So cold, flu, nausea, pink eye, just little things like that. They were given that power during COVID and they still have it. So they can prescribe some medication. So our sister that asked that question, you could go to Walmart or Superstore, any pharmacy around you and tell them, this is my problem. Can you tell me what to take? It's best to get it from the experts than asking people around you because pregnancy is very delicate. Thank you.
Yes, that's true. So any more questions, please?
Hello, just to appreciate you people. You've really done well for us, for the newcomers. You have opened our eyes. I've seen people that have paid through their nose for treatments. I had a friend that had a fall before we could get ambulance. And all these things, before we called Gerard Robinson, they were sending so much exorbitant price for the treatment. After 3 or 4 months, she had this issue. They didn't send to her initially, and she's on student health insurance. But with all this eye-opening, telling us to advocate for ourselves, you have really done well. We so much appreciate you. Thank you so much.
You're welcome,
Thank
my
you.
sister.
Thank you, Bemisola. You know, Bemisola, I don't know. You know, I don't know if you lived in Lagos or you know how Lagos operates, right? Lagos is the kind of place where you open eye. If you don't open your eye, they will just use you anyhow. That is same thing with people. So, and that's, for lack of words, that's I want to say, let's not leave that Niger spirit behind because it's what is going to help us here. You cannot come and be doing Canadian. Before you become Canadian, just behave like you're a Nigerian and you will get what you want. Just don't. And like Cynthia said, most of us are just afraid. If I talk too much, it will affect my PR moves. It will not affect anything. It will not affect anything. It does not, just so that you are at peace. It does not spoil anything for you concerning your PR moves. They like people who can talk for themselves, who can say, and yeah. So basically, just be rest assured it's not going to stop anything. It's not going to affect your PR. It's not going to affect anything. Just advocate for yourself, right?
So what now? Let me add salt to that. Salt and Gary, Abi. Okay, let me add something to that. So what I usually tell people is when you're advocating for yourself, do it respectfully. Okay, do it understanding that you have choices and you have rights. I'm a lawyer, but sometimes I have to beg the opposing counsel, not because my client is wrong or because, in a sense, I remove pride when I'm dealing with people. Let me put it that way. I'm respectful and I have no pride when I talk to people. When I want something, I focus on that thing I'm looking for. And if there's a way to get it from them, if it's begging that will give me what I'm looking for, I will beg. If it's quoting law that will get me what I'm looking for, I will quote the law. If it's telling them about my mental health problem or my physical disability, I will do it to get what I want. It's part of advocacy. So we should advocate for ourselves respectfully, understanding that we have choices, and also knowing that advocating for yourself will not affect your immigration status. But again, like we said, Ivy has offered herself as a resource, and I'm also here. You can call us, and hopefully we can help ourselves. Okay, I'm gonna leave you, Ivy. Thank you so much.
Thank you so much, Cynthia.
Hosting us.
Yeah, thank you so much for joining in and for the insight you provided. This meeting was actually supposed to be an hour's meeting, and we wanted to just took the liberty to go 18 minutes over, just so that we can make sure that everybody's question is answered, people's concerns are addressed, and I hope this was something you wanted, or it gave answers to your questions, right? I've seen some people thank us for the program, so I'm happy to know that at least we provided answers for people who needed answers. So thank you so much for joining in. If you didn't come in, this program would not be a success. We wouldn't have been able to host it. So we appreciate everyone for joining in. Madam Anne, Abis, Iradia, Anastasia, Eva's iPhone, Oluwayinka, Elias, Cynthia Uzoka, Cynthia all the way from Nigeria. Thank you so much for staying back this late just to tune in. Eyitem, Sophia, Jennifer, Duruchuku. I hope you've been able to find the link to join NIROW. I sent it in the chat box. I hope you saw it. Zainab, thank you so much. Bemisola, Adebisi, Ama, Fisayo, and Max iPhone. Thank you so much. Yeah, so this meeting has come to, this is where we'll be ending the meeting now. And thank you again for coming. So I would forward, like I said, I will forward the PowerPoint presentation and the resources that were in the links so that you can access them and see what it is which resources might be useful to you. I'll send them via the links that were registered for the informative session. Thank you so much, and enjoy the rest of your evening.
Thank you. Bye.
Bye. Good night. Telegram handle, Telegram, like I said, just go to www.niro.ca. NIROW is NIROW.ca and navigate to where you see become a member. You will have to fill in a form and verify your email or so, and then to take you directly to the Telegram platform. I can't do that from here. Thank you so much. All right. Good night, everyone, and thank you for joining in.